The third session of the 2023 Ohio State University Extension Beef Team's virtual beef school was broadcast via Zoom on March the 8th. The second portion of that evening's program featured OSU Clinical Veterinarian Dr. Justin Kieffer as he described the symptoms and impact of bovine anaplasmosis and management practices to prevent, manage, and control it. Near the end of his presentation, Dr. Kieffer also described changes coming to the way current over-the-counter medications will be handled beginning this summer and what constitutes a valid veterinary-client-patient relationship. Here, Garth Ruff introduces Dr. Kieffer and his presentation.
We'll kind of switch here to Dr. Justin Kieffer, veterinarian, Department of Animal Science. And Doc, maybe you're going to get to this, but a question that, we've had here in the eastern part of the state, and there's a lot of Virginia, North Carolina, West Virginia cattle fed in Ohio. What maybe are some of those best management practices from an animal health concern as we bring those cattle into the state to control ticks?
Yeah, I'll talk about tick control a little bit in relation to anaplasma, which is the first part of my talk. So we'll talk about some of the strategies to carry on from what Risa gave, which is some really good advice for ticks because they're just really tough to control, and it's a multifactorial effort to try to knock them down from managing the pastures and housing areas of those cattle all the way through medicating them and providing intensive vector control. So I'll get onto that in my talk there, Garth. Thanks for having me today. I'm going to talk a brief review about what bovine anaplasmosis is. Risa just talked about filaria, and anaplasma is related. It's transmitted through blood infections, through mechanical means, and through vectors like we talked about already with ticks and also with flies. So I'm going to talk about anaplasm, some management strategies you can employ depending on what your goals of your operation are and how infested your area is with anaplasma. And there's a lot of knowledge out there that we really have to gain in Ohio in anaplasma and do a lot more study. And I'll talk about a study that Risa and I just got published last year in a AVMA journal on a little small pilot study we did in Ohio to look at within herd prevalence of anaplasma and what we found from that, and some exciting new research into vaccines for anaplasma. And Garth also asked me to give an update on the new antibiotic regulations coming out soon in June. So after my anaplasma talk, I'll talk about how antibiotics that are on the shelf are going to come off the shelf in June and what that means for producers. So with that, I'll get started. A brief review of anaplasmosis. It's caused by bacteria, Anaplasma marginale. It's a bacterial infection. Here, this is a blood smear on the side of the screen. These are nice red blood cells. And here we got some dark white stain or dark stains areas that are anaplasma organisms. It is the most prevalent tick-borne livestock pathogen in the world, much bigger problem in the tropics, but it's starting to be a bigger issue here in the United States and not just in the South, but here in Ohio, as many producers are experiencing. The estimates, in the U.S. are variable. It's about $300 million in cost to U.S. producers annually, and I think that estimate could probably go up because that number is a little old, but it's a significant problem, especially in the state of Ohio now. The economic cost, and this data again is 40 years old, probably needs updates because we really don't have a lot of the impact economically currently to our beef herd. But from an introduction to a naive herd, we do understand you can have about a 4% reduced calf crop, 30% increase in cull rates, and about 3% of deads in clinically affected adult cattle, which is significant. So how do we get anaplasma transferred from cow to cow? It is blood transfer from infected cattle that have been infected, may or may not have gotten clinically ill, and then have recovered and become carriers for the rest of their lives. This could happen as a calf. And typically calves don't show clinical signs at all of anaplasma, unlike filaria, which Dr. Pesapane just talked about, which shows clinical signs in young cattle and adults. So they can get this infection from biological vectors or mechanical vectors. So biological vectors include ticks and multiple species of ticks, just like what Risa spoke about, and also mechanical vectors. So transfer from animal to animal, biting a cow, leaving the animal and biting the next cow, and that would be flies, specifically stable flies and also horse flies. And then people are big culprits in the spread of anaplasma from animal to animal. There are lots and lots of reports of outbreaks of anaplasma after we run cows through the chute for processing, for vaccination, deworming, hormone treatments, things like that, where we're using the same needle over and over again in multi-dose syringes. That is a great way to spread anaplasma. We can also spread it via knives, scalpels when we're castrating, tattoo guns that we press in the ear, we draw blood out, and dehorning equipment. So any kind of equipment that we use on animals, on cattle, that is contaminated with blood that we put into the next animal, it has a high risk of transferring anaplasma from animal to animal. There's also the risk, at least from a few South American studies, of pregnant cows transferring anaplasma to their fetus in uterus. That's rare. It's not something that we observed in our study that we did in Ohio, although it's a small study, but that possibility is there. It just hasn't been described really well here in the North American states. So the biological vectors, again, are ticks, and ticks in that nymph and juvenile stage can get infected if they bite a positive cow. I mean, keep that infection as they go through the stages, just like Dr. Pespain showed you in that really nice slide set she had. And that's called transstadial transmission. So they keep that infection in their gut as they mature, and they will feed, like Risa said, once during each stage of their life. That anaplasma organism can also grow within that tick and replicate itself, increasing the amount of infectious organisms and the count of bugs within that tick, which increases the risk of that tick transmitting it to the next animal that it feeds on. From what we understand, female ticks cannot pass this organism on to their offspring. So when they lay their eggs, that will eventually become nymphs on the next cycle. As far as we know, we don't appreciate the opportunity that anaplasma can go from one generation to the next. However, like Risa said, we have ticks that can last for a year or two, and if we don't get hard frost, they can last for much longer out on pastures, and that risk can remain the longer those positive ticks remain on your property. So what is the disease process once we get an infected animal? So after entering the body, that bacteria invade red blood cells. It's where it likes to hang out. Some nice pictures again here of infected red blood cells. When red blood cells are infected, that is a very strong signal to the immune system that they need to be destroyed. Those are screened by the liver and the spleen. When the liver and spleen see those red blood cells coming through that are infected, they pull them out and destroy them. The red blood cell counts then drop, which makes sense. And then we see the resulting anemia or low red blood cell counts and the clinical signs and symptoms that you might see on those cows after they're infected. Again, once they've had anaplasma and recovered, they have lifelong immunity, so they're not going to develop clinical signs again. Again, from what we know now, recovered animals can still carry anaplasma for the rest of their life, and they can go through cycles where they have low levels of anaplasma in their blood that will cycle up and down depending on season, stress levels, and things like that. And again, we see lots and lots of cases where we see waves of anaplasma cases occur after instrument use, especially needles across many different animals. So what do those clinical signs look like in cows with anaplasma? So if you're not aware or haven't had it on your herd, the things to look for, the clinical signs begin after about a 4 to 8 week incubation phase. And that's after, a good sign for that to show up is after the first frost in the fall, when the vector season starts to go away. Hopefully we have a nice frost in October or early November. And a few months later, we may see clinical signs start to show up. Again, it's most severe in adult cattle. And the way I understand that is that adult cattle are more susceptible because I think they have a less propensity to produce red blood cells compared to calves. They're older, their bone marrow is more aged. They don't produce as many red blood cells as quickly as calves, so they're not able to compensate as easily for that anemia. You're going to see weakness in those animals. Again, they can't oxygenate their blood very well. They have pale mucous membranes around their mouth and nose and eyes. You may see them off feed. We're also going to see jaundice. This is a picture of a necropsied cow up here in the upper right, where the fat is yellow. This is the byproduct of red blood cell breakdown, this bilirubin that's blown up in this fat. And also abortions. Abortions are a really classic clinical sign for anaplasma because when the cow can't oxygenate and she's pregnant, one of the first things she's going to do is dump that fetus out. It's a really stressful event, and abortion storms are pretty common scenarios in anaplasma outbreaks. If you're treating cows with clinical anaplasma, they may become aggressive. And that's usually due to the oxygen deprivation. They may struggle to breathe. They may be inspiring really hard, like this cow in this picture here. You need to be careful working around those animals. They're in significant respiratory distress because they can't oxygenate, and they may suddenly drop dead as you're trying to move them up to the chute to get them treated. So be careful working around them. So what are the treatments that we do have if you do see clinical signs? So again, exercise caution when you're treating these cows. Be careful moving them around. They may become aggressive. They may drop dead due to the stress if they're really, really severely ill and very anemic. If we're going to treat these cows, we need to catch it early on before they get really anemic. And there are some treatments that work pretty well. The main ones are oxytetracycline, long acting at 22 milligrams per kilogram. So that's in the muscle or sub-Q. There's also a labeled Baytril product, not the general Baytril that has the green label out there that we use for respiratory disease in cattle. It's the Baytril A1 or 100CA1 that's specifically conditionally approved for anaplasma infections, clinical anaplasma infections only. And when we're using Baytril, and your veterinarian will tell you that Baytril has to be used on label. We can't use it for anything else besides what the label says. In this case, we can use it for anaplasma infections, not control, but only for clinical cases in your herd. So if we get anaplasma in our herd and we've gone through, let's say, an outbreak, and we sit down with our herd vet and we need to think, how do we manage this in our herd? How are we going to deal with it? And I think that depends on what area you're in. If we have a lot of infected herds around us, the region that we're in, are we in the middle of the Florida swamps or in the Flint Hills of Kansas, where we see lots and lots of anaplasma? Are we in Northwest Ohio, where we don't see much at all? We need to figure out where we're at and how we're going to deal with it. In heavily infected areas, that's assuming at least 50% of the animals in your herd are positive. And that can be quite variable. Even in places like Florida, where you might think that every animal is positive for anaplasma, that's not necessarily true. Some of those studies from down south have shown cattle in those herds can have anywhere from 12 to 80% of the animals that are infected with anaplasma. So it's quite variable, even in really hot areas where they don't get any winter kill of ticks and parasites. They still have a really wide varying prevalence of anaplasma within their herds. But anyway, if we do have it in our herd and it's in a heavily infested area and we're not going to be able to, or assume we're not going to be able to eradicate it from our herd, we're going to assume most of the adults are carriers. We're going to go ahead and vaccinate the young stuff. That means using the same needle from older young animals on younger animals. It's called blooding in the tropics that they use for anaplasma and other bloodborne disease prevention in those regions of the world. And we're going to live with it. We're not going to swap new needles out with every animal. We're going to assume that the young calves are exposed and get them exposed when they're young. So that's the time when they're not going to develop clinical signs, and when they're older, they'll be protected. We're going to pulse feed tetracycline, chlortetracycline per VFD rates that your veterinarian can rate for you for 30 days. Pull them off CTC for another 30, then repeat 30 to help prevent clinical cases from occurring in your herd during that vector season. And then that really helps maintain that stability of anaplasma through your herd. You're living with it, but also limits your opportunities to sell your potentially anaplasma positive cattle in non-endemic areas, herds that don't have anaplasma. And it's something that you would have to tell prospective buyers of your cattle that, hey, we do have anaplasma, FYI, if you're selling stock out of your operation. In a moderately infected area, this is kind of what I would think Ohio would be, especially Southeast Ohio, where you'd have around 50% or less, positive herds in the area. You could use the vaccine strategy. You could live with it. You could pulse feed that tetracycline through that vector season, or you could get aggressive. You could really work on vector transmission and reducing that. So heavy treatment for fly and tick control. Some of the methods that Risa mentioned are really good on porons, dust rubbers and oilers, fly tags, clipping your pastures down to keep the ticks from crawling up on those high forages. And getting really aggressive with vectors can really help with that too. And then careful disinfection of your equipment between animals. If we're tattooing, putting breed tattoos in cows, if we're vaccinating, giving hormone shots, we need to swap out new needles between every animal. That's a really easy way to spread anaplasma, and that's a good break on biosecurity there, is to use a new needle with every animal. I know that can cost a little bit of money and a lot of annoyance in swapping out new needles, but it can really help prevent outbreaks. And then testing and possibly removing positive animals from the herd. And also in a non-infected area, let's say you're in an area and none of your neighbors and producers or you have infected cows, but you want to continue to look for this to make sure you don't have anaplasma creeping through your herd. You can work with your herd vet to develop a monitoring program. One of the best ways to do that is to test for antibodies. So that's IgG antibodies that develop after infections. That's an ELISA test, 4 to 6 weeks after the last frost, after those vectors have been frosted off, the flies are gone, the ticks are gone, hopefully. We're going to screen for antibody development. We could also watch for clinical signs of anaplasma. That's cows that are yellow, that have icteric mucous membranes in their eyes and their mouth. Sudden deaths, abortions, those things you want to investigate. Is it anaplasma or something else? Necropsies are really, really important in general for your herd to do exams on dead cows and calves to figure out why they died, and screening those for potential anaplasmosis cases is a good idea. And if you're bringing in new animals, everyone talks about being a closed herd, but lots of people like to buy bulls, the occasional special heifer, or some replacement females. Test those incoming cows, your new herd bulls, your replacement heifers, and quarantine them until you're sure that they're clear of anaplasma. And if they aren't, then you can think about not accepting them into your operation. So we used to think that we could clear anaplasma via treatment. There were some older studies that were published out there several years ago that using high doses of oral or intramuscular injectable oxytet spread out over several days that could actually clear experimentally infected cattle. And Dr. Coetzee and Dr. Curtis have some really nice studies out that have shown that these treatments are really unreliable, that what we thought was clearance in the past was really not, and our tests during those studies weren't so great. They weren't using PCR, they were using blood smears, it wasn't that accurate. So it's really not the case that we can actually clinically clear those animals with drugs. At least that's what the way the data shows right now. And our data that Risa and I had from our study last year shows that as well. There are also no antibiotics in the country that we can legally use that are labeled for the clearance of anaplasma in the US. We only have labels that say control via VFD feeding of chlortetracycline. So when it comes to testing, what kind of testing can we do? So like I mentioned, antibody testing, which is testing for IgG or antibodies that develop after the infection, again, 4 to 6 weeks, because it takes time after the infection for those IgG molecules to pop up. We can look for those on blood tests. Blood smears, a historic way to test for anaplasma. And if you have a really heavily infected animal, you're probably going to catch some of these red blood cells on this blood smear up here, which look really nice and pretty. But if they have a low level of anaplasma in their blood, it's a pretty high risk that you're not going to catch that on a single slide. PCR, polymerase chain reaction, that's a test that checks for DNA from Anaplasma marginale in the blood samples. It's a really highly accurate test that checks for current infections. That's a test we used along with ELISA in our study here in Ohio. So those are the types of testing that you can do in your operation if you're concerned about anaplasma. So what about vaccines? We like to use vaccines for respiratory disease, clostridial diseases. What about vaccines for anaplasma? So there is a conditionally approved vaccine on the market. I'm not going to go into the legal issues of conditionally approved vaccines and the lack of data that come with them, but it is based on, this vaccine is based on one strain of anaplasma, and there are several strains out there that infect cattle, and it's a killed bacterial product. They take the entire anaplasma organism off infected red blood cells and kill it and bottle it up. They claim, without any published data that I can find anywhere in the literature, that it reduces clinical signs of infection, but does not prevent infection, which fits with most vaccines. They don't prevent infection, but they don't back up any of their data with that. So we don't have any proof that this works. Also, this dose costs $8 per head. You need 2 doses, so $16 per head for a vaccine with no efficacy data published for veterinarians to read and understand. And also that could turn your herd positive for anaplasma. There's no way to distinguish a vaccinated cow with this product versus a naturally infected cow from anaplasma. So really not, in my opinion, clinically a good idea to use that vaccine, even though it's out there. There are some new prospects for vaccination out there. Some of my friends at Kansas State, Dr. Kleinhans and Dr. Coetzee, have done a really nice study on a mutated anaplasma strain where they've modified one of the genes to knock out one of the proteins on the outside surface of the bacteria. This was published, I think, last year. A really exciting study where the animals that were under control, that weren't vaccinated, developed severe infection, and so were the ones that got that conditionally licensed vaccine that I just showed you. And in this new vaccine, none of those animals developed clinical signs or actually red blood cell infection, which is kind of exciting. And they need to actually take the study out and spread it out. But under a challenge study in this model, it seemed to prevent infection and prevent clinical disease for anaplasma, which is kind of kind of exciting for us in the bovine world. In our study, talk about what Dr. Pespain and I did in Ohio. It was a small pilot study to look at within herd prevalence. So not looking at all the herds in Ohio and estimating how many were positive, but picking out positive herds and looking at the data, the demographic data within that particular herd as a percentage of PCR, the positive number of PCR positive cows for anaplasma marginale. And we had some varying numbers there from 19% in Lorain County all the way up to 56% in Coshocton County. So we were able to get 4 herds enrolled in this study. So average percent across all 4 herds was about 38%. We have our citation there at the bottom. That's our study. If you want a copy of that, I can shoot that to you. It's on the AVMA website, but if you're not a member, you won't have access, but we can certainly get that to you if you want to read it. Well, we found that older animals are more likely to be infected, which kind of makes sense. The more time they spend in the herd, the more often they're going to encounter vectors, the more often they're going to encounter a needle when they're coming through the chute. So the higher the risk that they're going to pick up anaplasma. We also noticed some serologic cross-reactivity to Anaplasma phagocytophilum, which is another anaplasma species that infects cattle that does not cause clinical signs, but can actually cross-react on serology with Anaplasma marginale. So some foggy areas in terms of test reactivity there we need to work on and learn more about. Like I mentioned before, we aren't able to, at least according to the current data, clinically clear cattle with treatment with oxytetracycline, and that was kind of borne out in our study here. We had 25 of 29 infected cattle from the Coshocton County herd that were treated with Oxytet prior to us coming and bleeding those cattle. They were still PCR positive for anaplasma after we tested them after they had been treated. And that kind of fits with Dr. Garcia and Dr. Curtis's work. And what we really need is a lot more study within farms is why they vary in prevalence, why some farms have really low prevalence, why some farms are higher, and what transmission route really predominates. Is it ticks? Is it flies? Is it needles? Is it a combination of those? We really need to understand more about that. We also need to do a lot more survey data within the state of Ohio to understand the regions that are most heavily affected and what those things that may impact there, the movement of cattle from operation to operation or the sale of cattle across county lines within the state of Ohio. You need to understand animal movement and prevalence to get a bigger picture of what's happening within the state. And we're working on doing some of that work at some point here in the future. So that's my talk on anaplasma. I'll wait till answer questions at the end. Dr. Garth wanted me to cover some of the impending antibiotic regulations that are coming on here in 3 months from the FDA that's going to impact you as the beef producer. So our animal drugs and actually human drugs are all regulated by the Food and Drug Administration under the Food, Drug, and Cosmetic Act. And that's the act, along with a few others, that regulates the drugs that we can use in animals, especially in beef cattle. So the way the FDA talks to us as medical professionals, as veterinarians or physicians, nurses, things like that, is they give us what's called a GFI or a guidance for industry. It's the communication they send out to us via PDFs, and they basically say, hey, we're going to use this, we're going to adjust this type of regulation based on federal law. Please issue your comments before we make a final ruling. And this is how we understand how the FDA is going to change regulations that impact us as practitioners. Back in 2013, in December of 2013, the FDA came up with some new rules for antibiotic use to help preserve the antibiotics that we use in livestock to prevent the emergence of antimicrobial resistant organisms and prevent the prospective transfer of those to people, which is important. And so they actually removed the medically important antibiotics for use in livestock for the purpose of growth promotion. There were some drugs, tetracycline, for example, was one of those that was labeled for growth promotion, at least in swine. I'm not sure if it was in cattle. And they removed those labels. They also changed all of our feed antibiotics from off the shelf, where you could buy them anywhere we wanted, to VFD status, which was implemented on 2017. You all may remember when Aeromycin came off the feed store shelf, and we had to get it through a VFD with our VFD with our veterinarian. And all the water-soluble antibiotics, let's say sulfa, that you could put in the water to treat your cattle, those came off the shelf and are moved to prescription status, again, in January of 2017. So again, more background. In 2018, the FDA came up with a 5-year plan to support antimicrobial stewardship in veterinary settings. So what does that mean? That is the proper use of antibiotics within small animals, equine and food animals. And they wanted to describe their process in that plan of moving all the dosage forms for medically important antimicrobials, and I'll talk about those in a minute, what those mean, into prescription status. And what we've done so far is we've moved feed to VFD. So if you're going to feed antibiotics, you have to have a VFD that's given to you by your veterinarian. Water-based medically important antibiotics have to be prescription. And now they're going to move the injectable and also intramammary routes, the drugs that you can buy off the shelf, also to prescription. And they did that in 2019. They issued another GFI to us saying, hey, just a warning, we're looking for your comments, but we want to move all of the remaining over-the-counter medically important drugs in animals to prescription status. And they published that in 2021, and it comes into effect in June, so 3 months from now. So how does this impact you as a beef producer? So the drugs that are available over the counter that you can walk into Rural King or Tractor Supply or the local feed store and grab off the shelf with no prescription from your veterinarian, they're impacted by GFI 263. And I've listed some of those here, and I can get you a complete list if you want, but I've tried to pick out the most popular ones that I've seen producers grab. So penicillin G, agricillin, there's lots of commercial labels out there for penicillin. That's going to come off the shelf. Benzathine penicillin, so Durapen, Comapen, that will come off the shelf. I don't use benzathine penicillin, by the way. I call it long residue penicillin, as my pharmacologist friends have trained me on. Doesn't really get to the levels that we need to treat the bugs that we're worried about, and it has a really long tail in the body of the animal, so it actually increases the risk of antibiotic residue. So that's why I don't use Durapen anyway. Oxytetracycline, so LA200, biomycin, agromycin, those drugs you can get off the shelf. That's becoming script. The sulfa products, sulfadimethoxine and sulfamethazine, that includes tablets as well as injectables. Thailand, lincomycin, it's not approved for cattle, but it is approved for hogs, which is over the counter. Cefafrin, which are the intramammary products for dairy cows. Gentamicin and chlortetracycline, the scour tablets, those are coming off the shelf and become prescription only as of June 2023. So what drugs are not impacted by GFI 263? So ivermectin, your deworming agents, moxidectin, which is Cydectin, all of your ionophores, which are lasalacid, or Rumensin, Bovatec, salamycin, vancomycin, are ionophores, which are not medically important. We can't use those in humans anywhere. They're toxic to people, but we use them for feed efficiency in cattle and for prevention of coccidia. Those are not affected by this rule. Tiamulin, Cora, that we use to treat coccidiosis, and other non-medically important antimicrobials as defined by the FDA are not going to come off the shelf. They should be available to you without a prescription. So, let's say it's June 2023, how do I access these drugs once they're restricted? So when the labels change on those drugs and it says caution, federal law restricts this drug to use by or on the order of a licensed veterinarian, means that you will no longer be able to grab that drug off the shelf. You'll need to work with your veterinarian to get them to use them in your operation. And the guiding principle behind that is that the veterinarian for the FDA is responsible for drug use oversight on farms. This is also true right now, even for those over-the-counter drugs. They're making it official, and that's through the concept of a veterinary-client-patient relationship, or a VCPR. Okay, what is that? So if you pull up the Ohio Revised Code, a VCPR is a legal definition for me as a veterinarian to understand your operation and be able to provide prescriptions to clients, for your livestock. And that has to be through 3 conditions. That means the veterinarian, me, has to be responsible for making clinical judgments on your cattle, evaluating them, providing advice for treatment, or directly providing treatment for you, providing medical services, emergency services, things like that, and giving you instructions and treatment protocols. I have to, as your veterinarian, have knowledge of the patient, which means knowledge of your operation as well, and been there for timely visits. And that timely visits term is defined by the FDA as every year, at least yearly visits. That's how most veterinarians assume that timely visits verbiage means. It's at least once a year. And that vet has to be available for follow-ups. If they're treating animals on your operation, providing treatment protocols, they have to be able to follow up if you have further issues. That's how I define a VCPR. That's how I, as a prescribing veterinarian, have to have that legal relationship with you, the client, to provide you prescription drugs. So why would you need a vet to use the drugs you've always used in your operation? I've used Pen-G forever in my cows. I've used Oxytet on my operation. Why do I need to have a veterinarian guide me? So, as veterinarians, we're trained on the types of antibiotics available, all the drug classes. We've been through lots of chemistry, lots of painful pharmacology lessons on how they work in animals, how they're eliminated through the body, whether it's feces or urine, what the residues are like, withdrawals to observe, which bugs they work on, and how to implement them in cases and when not to. And in some cases, antibiotics may not be appropriate at all for treatment. We may have been treating for years with an antibiotic that may not be effective. Let's say we have a case of mycoplasma on our farm, head tilts, respiratory disease, and we're using penicillin for that. Well, penicillin treats cell walls that mycoplasma does not have. That's just kind of a case in point there, where veterinary guidance can actually direct you to not using a drug at all, or using the right drug that's labeled for that particular condition. That's why having veterinarians' advice for these drugs is really important. Also, prescribing the right antimicrobial therapy, the right antibiotic therapy that can reduce the need for long-term treatments or repeated treatments, treating calves 4, 5, 6 times, and writing proper treatment protocols for you to follow, because drugs cost money to buy, they cost money to give. We have to observe slaughter withdrawals, have to keep treatment records, and they're all kind of expensive things to do. So we want to limit the amount of drugs we use to save costs, and also to slow the development of antimicrobial resistance in animal pathogens. Antimicrobial resistance is a big issue, and they are addressing this on the human side. I think that's the biggest driver of antimicrobial resistance, is the use in humans, but in livestock, it is important too. We use a lot of antibiotics, and we have some issues in livestock, especially in cattle, where we've seen some worrying development of antimicrobial resistance that we need to address in our own house. I've seen strains of Salmonella out there that are resistant to all the available drugs. Gotten those reports back from the diagnostic lab that say have a little letter R next to all the legal drugs I could use to treat that Salmonella case, and that's kind of alarming. If you search the Kansas State Diagnostic Lab, every a few years they publish a nice list of the bovine respiratory bacterial pathogens like Pasteurella and Mannheimia, and the number of isolates they get in their lab from feedlots and cow-calf operations that are resistant to Draxin, to tetracycline, to all the other different types of important antimicrobials we use in respiratory therapy in cattle, and those are pretty alarming too. So we need to kind of keep control of the antimicrobial resistance within our own house. If we ever do get a new class of antibiotic that's approved for livestock, or at least approved for humans, the chance of that drug getting a label to be used in cattle or swine or sheep and goats is really, really low. So we need to preserve the antibiotics that we have now and preserve their efficacy, so we don't lose the chance to use them when we do need them. We do need to use them in certain cases. So with that, Garth, I have seen my presentation.